Hello, good evening, Nigerians. It's another Tuesday, and you are very much welcome to Talking Health with Dr. Laz and your TV channel of choice, the African Independent Television, AIT. My name is Dr. Laz Eze. Yes, we are still in October. October is Cancer Awareness Month, and the previous week we talked about cancer, what it means and what can be done to control cancer here in Nigeria, and recommendations for various stakeholders. We are still going to be talking about cancer in the course of the programs this month, but today we are going to be talking about another very important topic that is very important for every family and every one of us in our society, but it has more to do with children. It's about malnutrition. What is malnutrition? Simply, if you're not taking enough food, or you're taking enough food, but the components, the various classes of food we learned in primary schools, different classes of food, carbohydrates, protein, fats, all of that. If you're taking them not in the right quantities or in excess quantities, it might be problematic, especially for children who are below the age of 5 years. In Nigeria, the numbers are not good, like in so many other health conditions. The UNICEF estimates that more than 2 million Nigerian children are severely malnourished. And of course, in terms of malnutrition in Nigeria, we refer more to undernutrition. We also have cases of overnutrition. Undernutrition is when the child is not getting enough. Overnutrition is getting excess, which can lead to childhood obesity and other conditions. So it's been estimated that even more Nigerian children are, getting to become overnourished or getting obese. But for the program today, is focusing more on undernutrition, where a lot of Nigerian children are not getting enough proteins, enough nutrients that they have need to grow, and for their brain to grow, for them to lead a very good life and help to the development of our nation. So I'm going to have two guests. One of them is a public health advocate and a veteran journalist. The other is a medical doctor who is also a health policy expert. So I will be introducing them after the break because they are going to weigh in to have robust conversation around severe acute malnutrition and what Nigeria is currently doing and what we need to do much better to ensure that our children are not dying and they are also getting developed. It's not good enough that the number of children per country who are stunted, which means they are too short for their age, is out of 137 Nigerian children under 5 years are too short for age. They are stunted. And UNICEF said that's the second highest in the whole world. This is not good at all. But we are going to be focusing more on the solutions. So please follow us on our social media handles and join the conversation. Ask questions, make contributions. And after the break, I'll be going to talk to Chief Moji Makanjuola, and she's going to bring a lot of insight on this topic. Do stay with us. We'll be right back. Thank you very much for being with us on Talking Health with Dr. Laz. I'm in the office of Chief Mrs. Moji Makanjuola, a veteran journalist, a health advocate, someone that's served this country covering health for over 3 decades on NTA, and he's dedicated her life on promoting child health, maternal health, and so many other aspects of Thank you, Chief Makanjuola, for accepting to talk to us. It's so good to be with you again.
Yes, thank you very much, and I'm excited to be on your program. And so, let's go on.
Yes, you've been very passionate about health issues, and especially when it concerns women and children. Whether we're talking about childhood cancer, we're in the Cancer Awareness Month, or severe acute malnutrition, you've always, have something to say. And there's a lot of challenges. We will not focus a whole lot on it, but on the solutions, which I know you've been championing all this while. On the problem of severe acute malnutrition, there are concerns among stakeholders that the ready-to-use therapeutic food is not adequate. In fact, it's actually 2 out of 10 children who are malnourished that have access to it. So the lack of funding for the production or procurement, to make this available. Do you share that kind of concerns, and what do you think about the entire issue?
Thank you, Dr. Laz. I do share these concerns. As a consortium with other partners, we are working in 5 states as I speak. And the severity of severe acute malnutrition, just is there in your face, where you see, we're not at war yet. We have our children, looking like war-torn areas, and looking like people, children in war-torn areas. And the only thing, one of the things that, that is available that helps these children, because it's like magic. You see them all, thinned out at kwashiorkor, and then they have the ready-to-use therapeutic foods. And in less than a circle of 14 to 21 days, these children are bounced back, although they would have missed out on some, some growth materials that are needed. But the fact that they still have a full life ahead of them, satisfies you. So for me, it's a great concern. Why? RUTF that we use in the country as I speak today, majority of it, in fact, are imported. So you can imagine, at some point, when the funds are not available to procure them, then you have what you call stock out. And when you have stock out, as a doctor yourself, you know the impact of that.
Yes.
So what we need to do as a country is actually building from the foundation. Because a malnourished pregnant mother is susceptible to having a malnourished child.
And actually, the National Demographic Health Survey have data that gives concern that even UNICEF, that 7% of women of childbearing age in Nigeria suffer from acute malnutrition themselves.
So you can imagine, it's garbage in, garbage out. God forgive. I need to use that because I don't consider kids or pregnant women as garbage, but that's the situation. A woman who is severely malnourished would, of course, have a malnourished child, at birth. And that's why you have low birth weight, and you have all the other complications that you as a doctor, and we should know as a people that we need to get it right. And getting it right means from the mother to the child. And if unfortunately some of these children come down with severe acute malnutrition, which everybody calls SAM, then there must be some measure of succor and intervention that is fast, that is sustainable, not one that you start on treatment today and then RUTF goes out of stock and then it's not available until you wait for another circle. And since it's procured, it's sent, imported from other countries to Nigeria, it takes a while to bring it in and stock up again. That gap, a lot of children, we lose a lot of children in that gap.
How do we close that gap?
That gap must be closed by local production.
Local production
Foods. Yes, of these foods. And there are industries in Nigeria that actually can produce, but they also have their own problem in terms of cost of production. It's expensive for them to produce when you look at how much they have to pay for light. If there's light, they have to kind of supplement it and supplement other things. There are also some issues of the main raw material in terms of how the standard, how secured it is, what insecticide in terms of the quality and all that. So a whole gamut of things that we need as a matter of urgency to look into to stop severe acute malnutrition. In Nigeria, we shouldn't have children that
get
malnourished. And moving forward from that, it's I just want to say that government alone cannot do it.
Yes, so do you have some specific recommendations for different stakeholders?
PPP comes in at this moment.
That's public-private partnership.
It's so important to these because if the manufacturers themselves are afraid, if they start to manufacture, would governments buy from them? And they are not going to do it for free. It's for profit.
Yes.
And the profit must be that which will ensure continued production. So
if I get you right,
yes,
you want a situation where the government is going to bring private players, work out a modality where they produce these ready-to-use therapeutic foods, and when they produce it, they are sure that they have the government to procure and also provide for these children.
For these children, because majority of those children that we see that are severely malnourished, you can read poverty on their faces. They are the faces of poverty.
And of course, we have the largest number of people living in poverty
in the world, which is a shame, true. And another thing that we need to say is that we are talking of accelerated development in this country. We need a healthy herd of people who are going to take over and take over from us. Those of us who are fortunate to have had what we call a proper, wholesome upbringing is because, there was education available. Nutritional education has become an imperative in my view, because some mothers don't even know, even the things that are available in Nigeria, which you and I ate growing up, which gave us all the immunity and what made us who we are things that we have eroded. We don't use them anymore.
Exactly.
So we need, and so it's important that the girl child is educated. The girl child, so that she knows the right mix.
That would take me to the next question, but we are going to take that after the break.
Okay.
When we come back, I'll be asking you your recommendations as a grandmother that you are, to mothers and other grandmothers, as well as the media where you operated for several years. Please stay with us. We'll be right back.
Thank you.
Yes, before the break, I was speaking with Chief Moji Makanjuola, and she recommended girl child education as a way to solve the problem of severe acute malnutrition. But I'm here with another public health advocate, a health policy expert, and the country director of Network of Health Equity and Development, NHED. I'm here with Dr. Emmanuel Sokpo. I'm very excited to be with you, sir.
It's a pleasure to have you here, and you're welcome.
Thank you. Doing a lot of work on severe acute malnutrition. I would just want you to educate the viewers very briefly what parents or guardians need to watch out for in identifying a child who is severely malnourished.
Thank you for your question. Severe acute malnutrition can easily be recognized by the parent because when you see a very wasted child with swollen tummy or swollen legs and sometimes a swollen face, it's obvious that the child is severely malnourished. And also a child that is severely malnourished and is not eating well. Normally a hungry child should be eating, but when the child is no more having interest in food, then it means the malnutrition is so severe that it's getting into his or her mental and GI system, and so his appetite gets lost, and that becomes a very real emergency.
Okay. Yeah. So what are the things that are currently happening, like what the government is doing and other stakeholders in solving this problem?
The government at the national and the state level has set up what they call sites for treating these children. They call them community management of acute malnutrition sites. There are primary health care sites, that are supposed to be designated nutrition sites that are supposed to be designated for treating these children. You have staff that are trained in those sites, and you have rapid, ready-to-use therapeutic foods. Which
so those are those powder-like.
Yeah, powder-like substances that are supposed to be available in those sites. And then when the children come, the normal thing is for the nurse or the health worker to assess them in terms of the weight and also measuring their mid-arm circumference. There are standards beyond which if you just take a measure of the mid-arm circumference or the weight of the child, it's a certain measure, then the health worker knows straight away that this child is severely malnourished, even if he's still not exhibited issues of, loss of appetite and all that, and then advises on the best thing to do. In the early phases of treatment, what the health worker will, one, educate the mother on the right things to do, and also provide the ready-to-use therapeutic foods, which are the core treatment.
It has all the nutrients.
It has all the nutrients for treating, children, and normally within 8 weeks, those children, come out of it. But then, if we don't have the ready-to-use therapeutic foods, you can also use local preparations. They are not as effective as the ready-to-use therapeutic food that have been properly, constituted for that purpose. So they take a longer time, and also the efficacy is not as much as the ready-to-use therapeutic foods, which are manufactured, unfortunately, outside the country.
Yes, I'm coming to that. So are there specific recommendations you need to make going forward on how we can solve this problem?
Yes, I think for severe acute malnutrition, there are two issues. One, children that are already severe acutely malnourished, they require treatment. And then those that have not yet been in that category. So you want to prevent those that are just moderately or mildly malnourished from moving into severe acute malnutrition. In that way, we use normal, treatment, normal foods and all that regularly to ensure that the child, doesn't fall into that, But then if they are now fallen into, if they now become severely acute malnourished, then it requires, using the ready-to-use therapeutic foods. And governments, at the federal and state level, some of the states are procuring these commodities, for use across the country.
So you support local production?
Local production is the key thing because one, it generates employment. Also, it stimulates local industry and ensures that the costs of these communities will surely be less.
Okay.
For imported costs, for example, 8-week treatment costs about 23,000 naira. We hope that if we're going to manufacture it locally, it might become much cheaper. Yes, much cheaper.
Thank you very much, Dr. Sokpo. I've been talking with Dr. Sokpo, Country Director of Network of Health, Equity and Development, NHED. So, and we've talked about. So we'll go back to Moji Makanjuola to continue the conversation. Please stay with us. Yes, welcome back to Talking Health with Dr. Laz. I've been speaking with Chief Moji Makanjuola, a veteran journalist and the founder of International Society of Media and Public Health. And we've been talking about a whole lot of issues around saving the Nigerian child from severe acute malnutrition. Good to be back to you,
Same here.
Chief Makanjuola. Yes. Right now, as a grandparent, a very good one for that matter, what recommendations specifically do you have for parents and grandparents on what they can do, within the Nigerian context to prevent our children from even getting severely malnourished?
Well, grandparents, particularly those who are educated, should be there at the community level helping to educate these families where you find the cohorts or clusters of children with severe acute malnutrition. And, it's there, Laz, you can show it on this program, where you have all the red dots, where, those spots in Nigeria. And it's not peculiar to just one part of the country. It is just that it's more severe,
Yes,
in some parts than others. Children that are unfortunately affected
Okay.
by
Those who are
severe
really
acute,
suffering
yes, malnutrition. I mean, and of course, nutrition should be seen as an integral part of healthcare delivery. So and so it should be adequately funded, whether it is for advocacy, whether it is to buy RUTF because we are not producing now, but it should be something that constantly we shouldn't entire gamut of yes.
So local governments could be doing education so that mothers will know the right
food to eat
within their locality.
Every strata of the community has a role to play. In ensuring that we should eradicate. It should not be seen. It should not exist. Not in Nigeria. Severe acute malnutrition. But unfortunately, we have, like we were discussing before this program. Of our children who unfortunately are in the IDP camps. They should be given special consideration. Yes, in terms of when you go to see and they're severely malnourished, not because they want to, it's because of the situation. So that also calls for concern. But
that brings me into the final question for you. In all this, where does your constituency come in?
My constituency has a lot of role to play, and that's what we are doing, advocating and giving visibility to what is happening. There are no sentiments about this. It's not about, these are progressive solution journalism that everyone in the media should take on and give some measure of visibility. Very important, because you cannot explain why our children are wasted, why some of them are dying, and according to WHO, close to we lose about 2 million per annum. That's a huge number of children dying, and these are the workforce that is needed, to build our nation. So we need adequate funding with capital backup. It's not enough to put a figure to it. It must be that money must be released on time.
So the state and federal government should have in the budget nutrition lines that will help, especially for children whose parents can afford proteinous foods.
And then
what about the school feeding program? That should be part of the solution. Or is it?
Well, I would also insist and demand and beg and request that the girl-child education becomes an imperative here. A girl child that is educated would know what to feed her child, so that child does not become a victim of SAM, severe acute malnutrition. So the whole gamut of it is important, and the media has an important role to play, giving visibility to this thing. Look, go around, do investigative journalism. One is not making noise in the air. Go yourself, go to the Seaman sites, go to the sites at the local government area and see for yourself and bring that to fore, so that the consciousness of Nigerians are touched for them to be able to help. And talking about help now, it's not just about government, Private individuals can also try to help, try to assist. Ask your local government, ask the state government. People are helping in several areas. There is call to action for help to ensure that our children with severe acute malnutrition are helped, that there is no stock out of RUTF, which is the only one that is known that can give them their lives back, and that we must ensure that our girls remain in school, are educated, for them to make decisions, nutritional decisions that will enhance them having healthy children. And beyond all of this, media must be in the forefront. Follow through with your stories. Don't just go to a site and see a mother with follow through with that mother that fortunately can go to the Seaman site and get RUTF and find out how that child has healed, so that we can have a balanced situation for people to know that it is not hopeless. It is not a hopeless situation. When the intervention is sustainable, when the intervention is there is hope for these children to survive. That they can move from that wasted child to a healthy child.
Thank you very much, Chief Makanjuola. I think you've given us a whole lot of dosage of information on prevention and primary prevention from girl-child education and all that's helping one another.
So we should be driving prevention and treatment.
And treatment as well, for those who are, so many of them, that's over 2 million of them, that are already malnourished.
Yes.
Thank you so much
You're
for
welcome.
what you're doing.
Thank you very much.
You and your team in helping the Nigerian child.
Thank you so much for having me.
So I've been speaking with Chief Moji Makanjuola, the founder of International Society of Media in Public Health, and of course a renowned health advocate who has pushed a lot of health issues, especially those concerning the Nigerian child. And she's made a lot of recommendations in the course of our conversation. So that's the much we can take today on Talking Health with Dr. Laz. See you again next week, same station, same time. Keep talking, keep watching Talking Health with Dr. Laz. Bye for now.